Hi guys, we are from World Med UPC, a student club at USC focusing on raising awareness on global health issues. I'm Maya.
I'm Jessica.
I'm Rae-Anne.
And I'm Jennifer. And today we would like to introduce some basic information about COVID-19, such as what the virus is, how it hurts our immune system, how it spreads, and some prevention methods and information about the COVID-19 vaccines.
What is COVID-19? The current pandemic is caused by a virus called severe acute respiratory syndrome related coronavirus 2, SARS-CoV-2, which causes a disease called COVID-19. Most people just call it the coronavirus. Actually, coronavirus are a large group of viruses that have protein spikes on their outer covering, making it look like they are wearing a crown. In Latin, the crown is called corona, and that's how these viruses get the name. How does the virus attack our immune system? A virus infects your body by entering healthy cells. There, the invader makes a copy of itself and multiplies throughout your body. The new coronavirus latches spiky surface protein to receptors on healthy cells, especially those in your lungs. Once inside, the coronavirus hijacks healthy cells and takes command. Eventually, it kills some of the healthy cells. Once you're infected, within 2 to 14 days, your immune system will respond with symptoms including fever, cough, shortness of breath, trouble breathing, a sore throat, loss of taste, or loss of smell. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia, an infection of tiny air sacs called alveoli inside your lungs, where your blood exchanges oxygen and carbon dioxide. For most people, the symptoms end with a cough and a fever. More than 8 in 10 cases are mild, but for some, the infection gets more severe. About 5 to 8 days after symptoms begin, they have shortness of breath. As fluid collects in your lungs, they carry less oxygen in your blood. That means your blood may not supply your organs with enough oxygen to survive. This can cause your kidneys, lungs, and liver to shut down and stop working. Not everyone who has COVID-19 has these serious complications, and not everyone needs medical care. But if your symptoms include trouble breathing, please get help right away. So next up, we have Rae-Anne telling us about how COVID spreads.
How does someone get COVID? Well, COVID spreads between people when they're in close contact with each other, usually by respiratory droplets. So, if anyone talks, coughs, or sneezes and they have COVID, it is possible that anyone nearby can get it. Nearby is usually 6 feet, which is the same as 2 yards or any distance that's less than that. And you need to be careful because anyone who feels okay or doesn't even look sick could still have the virus and be infectious. These people are called asymptomatic carriers. Now, let's listen to Maya as we talk about COVID prevention.
There are a number of ways to prevent the spread of COVID-19, and everyone, including you guys, plays an important role in reducing the spread. For starters, it's important to practice social distancing. If you want to prevent the spread of COVID-19, you should avoid large crowds, especially indoors or poorly ventilated places. And remember to stand 6 feet away from anyone not in your household. Even when social distancing, you should always wear a mask that covers your mouth and nose when in public places. Not only does this protect you from contracting the virus, but wearing a mask protects others by blocking particles or droplets that may otherwise fly when coughing, sneezing, or even just talking. Now, if you do need to cough or sneeze while in public, be sure that your mask is on and you sneeze or cough into a tissue or your elbow. Be sure to always wash your hands after coughing or sneezing. One of the best ways to protect yourself and others is by washing your hands with soap and water prior to eating or drinking, after using the restroom, and immediately after you return home from a public place. Hand sanitizer may be used if soap and water isn't available, but please note that it is not a replacement. Hand washing is important, so avoid touching your face until you have the chance to wash your hands.
One major prevention technique against COVID is wearing a mask, but it must be worn properly in order to work. Your nose and your mouth must be covered, and the mask must fit securely across your face to prevent COVID from entering into your system.
Please remember to wash your hands. You should use soap and water to wash your hands for more than 20 seconds.
Alright, so if you don't have access to running water or soap, you can use any hand sanitizer with at least 60% alcohol content, and you want to get enough hand sanitizer to cover all of the surfaces on your hands, and you want to rub your hands until they're dry, and this usually takes about 20 seconds.
These precautions help prevent the spread of COVID-19, and you too can help protect your family and community from the virus. Now Jennifer will talk about the importance of vaccines in the COVID-19 pandemic.
So the COVID-19 vaccine forces your immune system to make something called antibodies, which teaches your immune system to recognize and fight against the COVID-19 virus in case you actually get infected with it. So inside of a vaccine is the weakened or dead version of the COVID-19 virus. And you can think of this as like an exposure. Once your immune system recognizes the COVID-19 virus, it can fight against it in case you actually do contract the virus. Yes, the vaccine is safe, and no, it will not make you sick long term. The vaccine had to go through multiple trials with large amounts of people in order to ensure that the vaccine was safe. During the time between March 2020 to when the Pfizer and Moderna vaccines were publicly released, that time was used to ensure the safety and efficacy of the vaccine. Unfortunately, getting the vaccine now does not mean you can abandon all COVID safety protocols. Based on your occupation and your age, everyone is getting vaccinated at different times if they choose to get vaccinated. We must continue to protect ourselves and others, and you can do so by continuing to wear a mask over your nose and your mouth, social distancing, avoiding large crowds, and washing your hands often.
Thank you for watching. We hope you learned something from this video. Please continue to protect yourself and others around you. Stay safe and healthy. Bye.